For nearly 2 decades, Becky Rock has been at the forefront of patient blood management, reshaping how hospitals across Canada and beyond approach blood conservation and patient care.
I really don't think it can be implemented without nursing in a driving position.
As a nurse clinician and program coordinator, she knows nurses are pivotal to PBM, not only because they deliver hands-on care, but because they are consistently the most trusted voices in healthcare.
I think the trust is huge. So we as nurses wind up having a big opportunity connecting with our patients, connecting with other providers, and getting them to all look at this as in, okay, this is better, we can do this.
In this episode of Let's Talk Patient Blood Management, Becky shares how nurses can lead the charge in advancing PBM as a global standard of care.
We're here with Becky Rock, or Becky Rockstar, as I like to think of her as. The first question I have for you, nurses are often the center of patient care, and everyone thinks of a nurse as a bedside nurse and as a lovely person and as an advocate for the patient. That's the traditional nursing with the hat on. We can do a lot more things than that, and there's nothing wrong with bedside nursing at all. But what kind of unique skills make us especially well-suited to be leaders in implementation of patient blood management programs in healthcare organizations?
Nursing practice, nursing theory is about being advocates, educators, and relationship builders. While we may be practicing at the bedside, we are not walking into the room and saying, oh, here's my cardiac patient, here's my anemic patient. Instead, it's here's Mr. Jones. He happens to have heart disease, and boy, his dad jokes are hilarious. We know the patient. We know the family. We look at the whole thing as a system. We're not looking at the patient as numbers. We're looking at that patient. When it comes to PBM, PBM is something that is not just practiced in one little place or by one person. It's throughout the system. Nurses' ability to advocate and look at the whole picture, like the way they look at the whole patient, is the glue that links together everyone who's involved.
Do you feel that organizations can successfully implement patient blood management programs without nursing leadership involvement? Usually there's a medical director. A lot of times the lab is involved. What's the specialness of that nurse coordinator or nurse manager?
I really don't think it can be implemented without nursing in a driving position. We operationalize PBM day to day. PBM is not just practiced in one place or by one person, and it's not just like specific time places. We are the ones that are putting everybody together. Why we're so important is because we have that ability to get everybody practicing it all en masse. We initiate therapy and we're seeing it through. We're making sure that everybody's on the same page with safety. If you only have people that see one little part here, one little part there as their responsibility, we're not going to have PBM practiced as a whole, because it's not a surgery that's done and over with. It's part of the whole patient's continuum. We're part of shaping PBM and in leading it because of our ability to link it and glue it all together to make it work.
Becky, you and I, Christine, we run into each other at a lot of medical conferences for patient blood management. There is a lot of clinical support to educate the clinical side of patient blood management. Do you feel that nurse leaders have enough training and enough structure to carry out their job? And if not, what is lacking?
We learn all about the systems, we learn all about medications and drugs and all about how to care for our patients, our qualities in terms of how we make sure evidence-based care, but in school are not given specific training about anemia, what the various PBM strategies are, our role in implementing those, what we can do, and what our responsibilities are. I think that there are gaps in knowledge in terms of us all understanding patient blood management and what it entails and what our roles are. I think we need standardized practice and protocols that are well known So more training at the school level, more training in our hospitals and standards within our hospitals that we should follow, and more additional education so we can become experts or at least well versed in these areas. I do think that pushing towards nursing specialization, that's going to be the way to go.
I've talked to several nurses on this topic, and they often will say things like, I am building the airplane as I'm flying it. They don't feel like there's anyone specific to train them to be a leader in patient blood management. It takes a certain characteristic and personality right now to be a patient blood management executive leader, because you have to be comfortable with not knowing your role and still moving it and driving it forward.
Yeah. And depending on where you are, your role could be completely different depending on what kind of hospital you're in or what country you're in. So you're Canadian and your healthcare system is quite different from our healthcare system. How do you feel that this publicly funded healthcare system affects PBM priorities and implementation in a way that our system maybe is a little bit different?
If anybody is not familiar with Canadian medicine and what universal healthcare means, because I know that there's a lot of misconceptions about it and probably an impression of old, antiquated hospitals that don't have modern medicine and best practice. But Canadian hospitals are excellent, especially in the field of PBM. One of the very first trials, the TRIC trial, written by Dr. Paul Hebert, which really kicked off looking at transfusion requirements in critical care and do patients do just as well with a more restrictive approach. That was Canadian research. A lot of innovations have come from Canada. Canada's got excellent practice with that. I think what we do have is we have a standardized approach. Every Canadian province receives funding from our federal government to implement our healthcare. We can essentially run all of our programs to a certain standard. We can invest extra here or extra there if that's what the province wants to do. Ontario is a great example of this, where the whole province has what's called ORBCON, Ontario Regional Blood Coordinating Network. This is a standalone agency that's supported by the taxpayer, but has the ability to practice independently and support expertise in blood management and in research, protocols, looking at utilization. It really provides great resources. And because Canada has universal healthcare, this isn't trade secrets, it's shared. If you call up somebody, if I call up a colleague, they'll share with me their info, and that allows me to benefit my patients. So patients wind up having a great experience in receiving care in different areas if they are connected with a provider who goes, I know something about patient blood management, or I know who to call, and we'll find out how we can best help you. I think that standardization, that consistency, that universal approach, we're all in this together. Nothing about it is competitive and held privately, but that shared experience, it certainly helps me as a nurse, because then I'm not having to find things all by myself or feel like I'm alone. I totally appreciate that sentiment, that feels like we're flying the plane, learning how. It's hard when there isn't that standard experience in school to learn this. That's where we have the ability to mentor and support each other with this kind of knowledge.
Were there some specific guidelines specific to Canada that you find are really helpful that we can look at as a model for other areas?
There are a few nationwide initiatives and standards that have been shared, offshoot of the Choosing Wisely campaign, and it was called Using Wisely Canada. It was launched as a nationwide effort, and this is admittedly more optimal blood use, so about transfusion care. But at least it inspired thought and attention to getting everybody working in the same practices of evidence-based care with transfusion. So with the Using Blood Wisely initiative, it was about using one transfusion at a time, recheck hemoglobin before you consider another one, and using a restrictive hemoglobin threshold before you consider transfusion. It was great because everybody was asked to provide all their data ahead of time. Where are you now? Then there was, now launch these initiatives, see what you can do to support it. There was education that helped with launching this and providing the resources, little downloadable posters. Then there was the follow-up after some time. How did you do? That was great because we had to be honest with where we were at. Your data is your data. And sometimes it was hard to find that data. Not all of us had access to that. We didn't have a great infrastructure for sharing that. But I think what was fantastic about that is, as I mentioned, it got everybody on the same page, everybody working together and paying attention to this and realizing it mattered. So having that happen countrywide was great. Now, we also have what's called the National Advisory Committee for Blood and Blood Products. And this is mostly about utilization, new initiatives, if there are some safety information. This is a team of experts from across the country who are part of this committee who would speak to items or act on them. They did wind up implementing a number of years ago the National Advisory Committee PBM statement. It was a document put together. Dr. Ryan Lett from Saskatchewan was part of this committee. He, along with his colleagues, put together this document which outlines recommendations for patient blood management, strategies to employ. It wasn't anything that wasn't familiar to expert organizations like SABM or NATA or other world organizations that promote PBM. It was standard evidence-based practice. I think we've got more work to do to get this in every hospital and have everybody doing it, but it was great that this became a national approach, a national feature for all of us to be guided by.
That's great when the government is supporting the whole country in developing patient blood management guidelines and resources. Would you say in all of the different provinces, are they all standardized in their PBM implementation and practices? Or are you seeing that they are very different from province to province?
Yeah, more work is needed for sure. Every province runs their own healthcare for all of the people who live in that province differently. We've got very different approaches. Ontario, if I use that as a first example, they've got the provincial organization, ORBCON, but they also have the On-Track program, the Ontario Nurse Transfusion Coordinators. Not every hospital in the province of Ontario has a PBM nurse leading initiatives in that hospital, but many of them do. They wind up following a standard approach with, say, anemia management, supporting other PBM strategies for all the patients within that coordinator's jurisdiction. I am in the province of Alberta. We've got two large cities, Edmonton and Calgary, and we've each got providers in our cities who support multiple hospitals under our belt. So we don't all get our own to be able to manage, but we kind of have to spread ourselves a little bit more thin. But we operate in a coordinated way. So if we implement policies in one hospital, they'll be in all of the hospitals within our area. So we don't have a provincial organization like Ontario, but we work on these in a little bit more of a smaller scale. Some provinces will have no infrastructure. Some of them have bricks and mortar patient blood management programs, an actual door you can knock on, find a person. But some of them have managed to implement PBM practice almost in a virtual way, which is really quite great because they are able to support the practice, promote the practice, and get everybody doing it without having major overhead costs. So is it ideal? Well, it's something. And I think that's a great feature. I would love to have it more standardized across every province in Canada. We're not there yet, but I think we've got a lot of great supports in national approaches and shared approaches, in that universal belief that everyone is equal, everyone should have access to healthcare, that I think might set the conditions for this to get better in the future.
We have a lot of standards in the US and Canada and all over the world, really. There's several different places where you can find standards, which is great. But sometimes it's hard to know exactly how to implement them, how to make it work. Like, I know my objective, but how do I do it? And I know nurses are creative problem solvers and innovative. We do a lot of different things. Do you see a role for expert PBM nurses going into the other hospitals to teach nurses how to implement? And it's not always standard, like you said, even in Canada, place to place, it's different types of hospitals. So where can someone go and how can we go about giving nurses tools specifically for implementation, and what tools are available to us?
There's no question that the people who have implemented PBM programming in their hospital or in their institution, whether small scale or large scale, have experience and nuggets of wisdom. And we tried that, didn't work, tried this, it did. Let me tell you about it, kind of expertise to share. I do think that there's a great role for people who have that kind of knowledge and know-how to share it. I would absolutely say people resources, people mentors are huge. Now, next, there are also courses you can take on implementation. You can listen to experts speak in presentations and lectures about PBM implementation. You've got to connect with multiple hospital departments to do this. This isn't just something that the surgery department decides to do individually without the help of pharmacy, laboratory, and that executive suite, the administration and leadership to get the barriers out of the way, provide the funding, get the right people connected to make it happen. Learning about implementation from people who can say, okay, so we're going to need a business plan here. This is what you're going to have to address. Your executive or your C-suite, they're going to be concerned about economics and finances and quality and safety initiatives. Here's how you can verify and reassure them. PBM addresses this. PBM is not going to cost you more. PBM might actually reduce costs or provide revenue. People who can coach you along with how to have those conversations can help you do that implementation. Who do I talk to first? What do I say to them? What are some quick wins that I can start with that get everybody trusting and saying, actually, this does make sense. We can do this. The learning from fellow people, the learning from courses and education programs that teach you about the steps to do it can go a long way to helping you go, okay, now I can do the do because I understand the process.
We need copies of ourselves. We need to duplicate and replicate pretty quickly. I also love your point about the additional training that maybe we don't think of as standardized nurses. Our core education helps us to think very much the same across countries and across the discipline. We're system thinkers. That came from our formal nursing training. But I remember one time in conversation with you, Becky, how you told me, project management. I take courses on project management. That's how I have been able to frame up some of my work. Even that tip was so helpful because then I sought training in project management. Now in my second role as a PBM executive, I've now taken on Lean Six Sigma training, root cause analysis training, and all of those things that I didn't necessarily learn in my core nursing. I'm learning how that extra training is helping me to become a better and better nurse executive in patient blood management.
In my current position now, I'm creating like a group of nurses that are interested in blood and PBM. And every month we meet and we talk about different topics. And I've been trying to give them projects so that they can make posters and do presentations and they want to publish. It's just a matter of, like you said, telling people, you know what, this is something you can do and I can help you. I can help you to do it. That's how we grow this, because a lot of nurses they may have heard the term patient blood management or maybe not, but they don't understand the power that they have. I think it's really important for us to show them, this is what you can do. This is how you can change your patient's life. 'Cause that's really what we all want to do. Let's be honest.
Yeah.
We all want to change everybody's life. We want to make them better. We want to make them feel better. We want to heal them. And part of this is helping them to heal themselves and really take a little bit of control over their own health, which I think in this day and age with all the information that they get and they're inundated and then they Google it and then they ask their families, it's scary. It's a scary time. People have a lot of issues. And if there's things that they can do to help themselves, it puts just a little bit more control in their hands. And I think that really helps the patients as well.
Yeah. I think the trust is huge. When patients wind up falling away from science and going online, they might find a community of people who are telling them things, which may not be science-based. It's unfortunate that what winds up leading to that and somebody going to a forum of non-experts for information is because something happened to cause them to lose trust. Either
Hmm.
somebody dismissed a concern, or I can't even think of all the things that could happen to somebody to break that trust. But that trust is going to push you away and make you look elsewhere. If they're going to look elsewhere, we'd want them to go to somewhere which is going to give them good quality information that's got their best interest at heart. But we know they don't always find that. When we look at blood, when we look at blood transfusion, so this is a practice that's been in medicine for decades and decades. It has become safer in many ways by testing, reducing risk of transmissible diseases, despite the public and despite medicine's regard for it to be safe. We know it's not risk-free. There are issues with it.
Yeah.
Those of us who promote and practice PBM, optimal blood health, are having to ask people to break that trust in blood as being the pinnacle, the one and only, and look at PBM not as an alternative, but the way, the better way, the evidence-based way that's associated with better outcomes and all these reasons. So we as nurses wind up having a big opportunity through our trustworthiness, connecting with our patients, connecting with other providers, and getting them to all look at this as in, okay, this is better. We can do this, instead of thinking that we're selling something that's substandard. Actually, this is superior.
What would you advise a hospital or an organization that was looking to implement patient blood management?
First of all, I'll recommend the organizations like SAVM, Society for Advancement of Patient Blood Management, organizations like NATA, Network for the Advancement of PBM, Hemostasis and Thrombosis. These are going to be organizations that will have education and information about all the principles and the strategies of PBM. The World Health Organization launched that whole number of important pieces about PBM, the urgent need to implement PBM. And now, newer of this last year is the implementation guideline. That can absolutely be looked at and followed piece by piece. Some things may or may not apply to your institution, but all of the outline is there for you to really get a sense on where to start, where you can pick up the ball and keep running with it if you've got some advances, some things you have been doing. And with that, through those organizations, through the WHO.
I agree. So PBM's in essence taken over the world then. So now that the WHO has acknowledged PBM, how close are we to nursing really acknowledging the specialty of PBM? I know we've done some work on that. It's really important because it adds a lot of credibility. I really think it's time for us to start acknowledging that this is a specialty. And it's a very important specialty that requires a lot of knowledge.
Oh, I would fully agree. With the many nurses around the world who provide this care and practice in this area, we know that we already are a unique area of nursing. We can essentially say, we are PBM nurses. This is what we do. There's a formal process by which to be officially recognized by major nursing organizations. So in the United States, there's the American Nursing Association. Canada has the Canadian Nursing Association, and all of these types of organizations around the world recognize those specialty areas of practice. There are many places by which nurses have said, this is our area of practice, which is unique. This is why it's unique. These are our scope and standards of practice that show why we're unique compared to other nurses. There's no question that when you have that expertise under your belt, there's a sense of pride and ownership, and also a responsibility to advance this practice. So there have been a group of us within SABM that have been working towards getting official recognition of PBM as a specialty area of practice. We've submitted an application and are in the process of having this to be reviewed. And we're certainly hoping that we can get a chance to review their feedback and fine tune this and get it published. Have this be publicly available, broadcast, by which nurses can look at this and go, I practice in PBM. I want to work on this so I meet every standard and I can demonstrate to others that this is my area of expertise. You can trust me. Let's work together on this. So we're getting there. It's taken longer than we had anticipated. We're trying to be patient, but we're not going to sit on our laurels and wait. We're going to keep pushing for it. So look forward to it.
We are definitely not going to give up. If you were talking to an individual nurse and they were interested in becoming a patient blood management leader or executive, how would you advise them? Because you're a lone wolf usually in an organization or an area, so you're not going to usually get a large team. Is there any particular personal qualities or things that you would recommend to someone who's considering this field?
You're not going to land in something with all the rules, all the strategies, all the resources available to you. You are going to have to do a lot of creative work. You're going to have to do a lot of relationship building. And there might not be somebody who's pushing you and nudging you the whole way. So being a self-starter is going to be really helpful. Being tenacious is going to be important too, because you are going to encounter those people within healthcare or perhaps patients and their families alike who are like, what are you talking about? Just give me the standard of care. Like, isn't that what you do for everybody? Looking towards this as being evidence-based, the new way, the superior way, you're going to have to be part of convincing everybody, showing the evidence and getting them to trust you. If you're the kind of person where if somebody says no and you shrink like a little violet, you're going to have to thicken up your skin. But also positivity. You really want to make sure that you're coming at this and including everybody. You don't want to make it look like it's your way or the highway. You want everyone to contribute and everyone to feel like they're involved because PBM is multidisciplinary. It's not just the physician's or the prescriber's job, not just the nurse's job. It includes laboratory, it includes pharmacy. So when everybody sees that they have a role, they're going to wind up contributing extra bricks to build this whole thing. Be a relationship builder, be a collaborator, and you're likely going to have more success there too. Of course, don't forget, like you've got to be a person who sees that patient as the pinnacle. PBM has patient built into its name. If you don't look at the patient as an individual with rights and their whole autonomy to make choices in their healthcare, instead you think that they should just take what we tell them, you're not going to be the right person to lead this because the patient is at the heart of this. We want them to feel empowered to make decisions for their care. We want them to understand what's happening to them and what their choices are so that they can recognize, okay, I can do this. Or if you say this is the recommended treatments, I can choose one and know this is the right choice for me. You got to absolutely have those people skills in that aspect too.
Absolutely. In some ways, and I don't know if you guys will agree with this, but this is how I see myself as somewhat of a disruptor. Changing the way people are thinking, changing the way we're doing things, looking at the system and saying, this can be done better. If we do a little bit of pre-work here, optimization prior to surgery, or think about things, then we don't have to put a fire out later. So it's really like a disruptive way of changing healthcare.
Yeah. I think the ability to have difficult and yet respectful conversations is a great skill that you need to build, right? Because you are that team builder. At the end of the day, you want everyone on your team. Respect for everybody's input and expertise, their experiences. They have a lot of past experiences that they are also relying on. You're weighing that against evidence, right? So those relationships and that communication skill is always a nice, delicate balancing act. You have to have that core of respect for your team.
Absolutely.
Yeah. I have a good story that kind of goes along that line. And it's not actually related to patient blood management, but it was about a nursing leader. This occurred many years ago. It was about when epidural catheters were first being introduced in nursing units for managing pain. So they would come out of the OR and this patient would still have the epidural inserted and nursing would be responsible for running the infusion and having our acute pain service follow them. This one nurse who was a leader, was tasked with implementing this whole program. She faced a lot of pushback from the nurses on the technology and this belief that's the doctor's job, epidurals, this is not us. And this nurse, she was a disruptor, she was tenacious, she was strong and confident. And she basically came in there to the nurses and said, we can do this, we will do this. And here's why. And here's how you are going to be an important part of this patient's care because of your involvement. And now you couldn't take those epidural catheters away from the nurses if you tried, because now they see it. But it took somebody like that mentorship type of role to go, yeah, we can. We're nurses. Like, here we go. Right.
We're going to own it.
Yeah.
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 Yeah. Awesome. Great story.
Yeah.
You are a leader in this sector. What's your takeaway for nursing in patient blood management? Where do you see the future lying? Where do you want to drive this ship?
I want to see nurses seeing themselves with a seat at the table that they've earned and they deserve, and recognizing the value of their seat at that table. Using the table as a metaphor to what are we going to do to bring everybody together? And seeing their opportunity through all of their inborn skills. There's a reason why they came to this profession. That those personality traits of theirs that brought them here, the training that they received that brought them there, and the innovations that are ahead, that they are perfectly suited to support PBM, and that they should expect to be there to support leading PBM. I hope that we see ourselves as being valuable contributors and leaders in this area because of all of those characteristics and skills. You can have certain organizations that have the greatest of strategies and plans and things that they want to do. But if they can't communicate that strategy, if they can't rally everybody to want to implement it, then the greatest of strategies are no better than the paper that they're written on. Nursing has that ability to lead, to inspire, to collaborate, to build trust, and to empower everybody to have that part of it. So by all means, nurses out there, look to lead in this area, because who's going to benefit is the patient. And that's why we're all here. Thank you so much for the chance to do this. Your podcast does a great job of putting this on the map, making it accessible to everybody who's out there. So I hope you please keep doing this. I hope people share this and continue talking about it. So big thanks. Appreciate the chance to visit.